Assalamu alaikum. This is week 12. I, Dr. Tamkeen Saleem, welcome you to the lecture for topic on diabetes. The learning objectives for the present lecture are: what is diabetes, what is impact of diabetes, what is involved in adjusting to diabetes, the role of health psychology in involvement with treatment of diabetes. These will be our core focus for this lecture, and I hope you will be able to learn about these. Diabetes is a chronic disease that occurs when the pancreas is no longer able to make insulin, that is, the glucose or the sugar found in the body, or when the body cannot make good use of insulin it produces. There are three types of diabetes, known as type 1, type 2, and gestational. Type 1 can develop at any age but occurs most frequently in children and adolescents. When you have type 1 diabetes, your body produces very low or no insulin, which means that you need daily insulin injections to maintain the blood glucose level under the control. However, the type 2 is more common among the adults and accounts for around 90% of all diabetes cases. When a person has type 2 diabetes, the body does not make good use of the insulin that produces. The cornerstone of the diabetes 2 treatment is healthy lifestyle, including increased physical activity and healthy diet. However, over time, most people with type 2 diabetes require oral drugs or insulin to keep their body and blood glucose level under control. The third type of diabetes is gestational diabetes, which develops in some women during the pregnancy. Gestational diabetes ends when the pregnancy is completed, but the disorder complicates pregnancy and present a risk for the development of type 2 diabetes in future. Let's discuss the physiology of diabetes. Pancreas, which are located below the stomach, produce different types of hormones. The islet cells of pancreas produce two different hormones which are very much significant in diabetes, which are glucagon and insulin. Glucagon stimulates the release of glucose and therefore acts to elevate the blood sugar levels. The action of insulin is the opposite. Insulin decreases the level of glucose in blood by causing tissue cells membrane to open so glucose can enter the cells more freely and efficiently. The disorder of islet cells result in difficulties in sugar metabolism. Diabetes mellitus is a disorder caused by the insulin deficiency. The islet cells do not produce adequate insulin. Sugar cannot move from blood to the cells for the use. Thus, the lack of insulin prevents the body from regulating the blood sugar level. However, the excessive sugar accumulates in the blood and also appears in abnormally high level in the urine. Previously, I mentioned regarding the insulin production, that is a hormone which is produced by pancreas, and it allows for cells to use the glucose sugar. Without it, our body cannot create energy. When the insulin is not produced or body is not able to use it effectively, it leads to raised glucose level in the blood, which is known as hyperglycemia. Over the long term, high glucose level are associated with damage to the body and failure of various organs and tissues, which means that it is a precursor of many other diseases. In diabetes too, not enough insulin is released into the bloodstream, or the insulin cannot be used properly, as mentioned previously. Thus, the too little sugar in the bloodstream causes a state that is called hypoglycemia, which is usually the side effect of the treatment with blood sugar lowering medications. And the symptoms of hypoglycemia are shaking, sweating, anxiousness, anxiety, hunger, rapid heartbeat, blurring of the vision, weakness, fatigue, headache, and irritability. Whenever a patient reports about low blood glucose, there is always a fast action required, that is, provision of carbohydrate. That may be glucose tablets or the syrup, that may be 1 tablespoon, or sugar dissolved in half cup of water, sugar um, related substances like some sort of juice or a tablespoon of honey. Do not give food or drink if the student or the patient is unconscious, having a seizure, or is unable to swallow. Give glucagon if delegated. Hypoglycemia is life-threatening if left untreated. For the diabetes that begins during childhood, both children as well as their parents must come to the terms with children's loss of health and the management of the disorder, which includes careful restriction in diet, insulin injections, medications, and recommendation of regular exercise. Dietary restrictions include careful scheduling of meals and snacks as well as adherence to a set of allowed and disallowed food. The diabetics, whether adults or children, must test their blood glucose level or sugar level at least once a day, and in few cases there may be requirement of conducting that several times a day. Drawing a blood sample and using the testing equipment correctly is also the need. Diabetes has a lot of effects. It may affect the sexual functioning in both men and women. Diabetic women who become pregnant often have problems regarding pregnancies. Then there may be some kind of circulatory problems. People become aggressive. They may direct their aggression outward and refuse to comply with their treatment regime. They may become dependent and rely on others to take care of themselves. All these reactions can interfere with the management of diabetes and may lead to serious health complications, including death. As diabetes has a huge impact, both types, that is insulin dependent type 1 and non-insulin dependent type 2, require changes in lifestyle, as mentioned in the previous slide as well, including monitoring and adherence to a treatment regime. Treatment includes insulin injections for type 1 diabetics and adherence to careful dietary restrictions, scheduling of meals, avoidance of certain foods, regular medical visits, and routine exercise for all diabetics. Health psychologists are involved in helping diabetics learn self-care to control the dangerous effects of their conditions. Resuming to the role of health psychologists with the diabetics or what can be done for them, health psychologists seek to both research as well as treat diabetes. Researchers have concentrated on the effects of stress on glucose metabolism, the way that diabetics understand and conceptualize their illness, the dynamics of families with diabetic children, and the factors that influence patient compliance with the medical regime so that the medical adherence or the treatment adherence can be enhanced. Health psychologists orient their efforts towards improving adherence to medical regimes so the diabetics can control their blood glucose levels and minimize the health complications, as well as they help them combat their stress, which may be cause of hyperglycemia. Stress may play roles in diabetes as a possible cause of diabetes and as a factor in regulation of blood sugar in diabetics. Stress affects glucose metabolism and control among the diabetics. A meta-analytic review shows that having a stress-prone personality and experiencing stressful events both predict poor metabolic control. This was studied by Shida and Hammer in 2008. A study of people with diabetes type 2 showed that adding a stress management component to diabetes education has a small but significant effect on blood sugar level. This was a research that was conducted in 2002 by Surwith and Associates. Negative emotions can adversely affect the diabetes, and interventions to manage stress and depression can be worthwhile and cost-effective component for the diabetes management program. because depression is another factor that affects diabetes and worsens the blood glucose control. Social support appears to be particularly important because there may be some kind of reminders that may be given. So, as poor social support is a psychosocial factor most strongly tied to the poor diabetes management. Health psychologists often work for development of stronger social support systems. They involve the families so that appropriate treatment or following of the medical regime may be carried out, and it may improve the quality of living of the individual with diabetes. Health psychologists also research diabetic patients' understanding of their illness and how that understanding affects their behavior. In one of the previous lectures, we covered the topic that was regarding the illness beliefs. Therefore, the inaccurate beliefs can have a significant impact on the self-care. Therefore, the health psychologists work on illness perceptions of the clients or patients. They work for adherence to the treatment. Continuously, we are discussing regarding adherence to treatment because when there is a chronic illness, it's difficult to adhere to the medical regime. Health psychologists study adjustment to the disorder and compliance with the necessary life changes. Few people with the diabetes adhere to all aspects of blood glucose testing, medication, diet, and exercise that minimize the risk of health complications. There are several skill training programs that may help the diabetics in order to um, develop some kind of care for themselves as well as learn the responsibility to manage their diabetic problem.